Thailand may face a real crisis as third virus wave fails to slow amid record deaths, says top doctor. Thailand is lagging behind most countries in Southeast Asia in its vaccination effort as it has been plunged into a third wave of the virus, which one Bangkok Institute researcher has suggested this week may not be brought under control for 4 to 6 months based on the testimony of epidemiology experts. The scale of the health and economic challenges facing Thai officials and the government is growing as the country recorded its highest death rate on Monday, and with fears that this third wave of infection, which has dwarfed everything since the pandemic began, may take longer than anticipated to bring under control, with one think tank expert, in recent days, suggesting 4 to 6 months. One of Thailand's top doctors on Monday warned of a real crisis now in the making as the public health service scrambles to cope with rising infections and hospitalizations from the disease. Dr. Prasit Watanapa made the pronouncement on Monday as concern is growing that the kingdom's vaccination program is too far off, while the third wave appears to be taking hold in urban centers, particularly in Bangkok, where the army is installing a 300-bed field hospital in the Klong Toei area of the city. A leading Thai medical expert is raising the alarm that the kingdom could be facing an unprecedented crisis as the death toll from the COVID-19 virus hit a new high on Monday, and with 31 people reported dead in Thailand, with new infections rising to 2,041 cases. Nearly 30,000 people have been hospitalized with the disease, with a surge in critically ill patients and those on ventilators. It is being reported that while infection rates are going down in many parts of Thailand, the rate of infection in the inner city areas of Bangkok is causing deep concern among officials at the Center for COVID-19 Situation Administration, CCSA, with many new infections coming from people who are living in close proximity to family members. In the last few days, Nonrit Basanayabat of the Thailand Development Research Institute has suggested that, based on the expert opinion of top epidemiologists, the third wave of the virus could take between 4 and 6 months to be under control. 50% of cases linked to the infectious UK strain as Britain returned to normal over the weekend with football matches and live concerts. The media also heard that 50% of the cases in this new, more deadly third wave, driven by a far faster rate of infection, are linked with the B117 strain of the disease first detected in Britain. Over the weekend, life in Britain appeared to be getting back to normal, with fans attending football matches again and a music concert taking place without masks and social distancing after the United Kingdom managed to vaccinate well over 60% of the population and over 90% of those over 70 years of age. Thailand's failure to prioritize vaccine procurement has left it trailing behind Southeast Asian countries. The experience in the UK, perhaps the most successful story in the world right now when it comes to COVID-19 recovery, shows clearly where Thailand went wrong in not prioritizing the purchase and distribution of vaccines at an earlier stage and targeting a greater variety of producers and suppliers. Thailand now lags behind many countries in Southeast Asia, where Singapore and Indonesia lead the way, followed by the Philippines and Malaysia. Even Cambodia has more people vaccinated at this time, with the most recent reports showing that 0.33 million have been vaccinated, or a 7.1% of the population. Only 2% of people vaccinated in Thailand. Thailand over the weekend pronounced that it had vaccinated 2% of the population, although it is not clear if these are first doses or people who have been vaccinated with their first and second shots. Populous Klong Toei area of Bangkok with slums and market has become a COVID-19 infection hotspot. One of the areas hardest hit by the new wave of inner city infection is Bangkok's Klong Toei district, where a spokesman for the Thai army, on Monday, Colonel Chatrapipuan Sawat, confirmed a field hospital containing 300 beds was being erected by the military. The military facility is being established at a warehouse facility at Klong Toei port. In April, the populous district on the Chao Phraya River in Bangkok, with over 100,000 residents, known for its slums and popular markets, reported 304 cases. Real crisis may be developing if the figures do not go down and instead continue to rise. That means we are moving towards the real crisis stage, Dr. Prasit Watanapa, the Dean of Faculty of Medicine, Siriraj Hospital, Mahidol University, said to Daily Briefing at the Center for COVID-19 Situation Administration, CCSA, in Bangkok. Expats over 60 and with underlying conditions can register for free COVID vaccinations in June and July. He urged the public to seek out a vaccine and to continue to wear masks at all times while complying with protection measures announced by authorities. Key advisor to the PM on the disease, Dr. Prasit, is one of Thailand's leading medical practitioners and a key advisor to Prime Minister Prayut Chan-o-cha. He has treated patients with the disease at the internationally renowned hospital, including 59-year-old Samut Sakhang Governor, Virasak Vijit Singsri, whose condition at one stage was extremely serious and critical after becoming infected in December 2020. Samut Sakhang Governor in a critical condition after developing a lung infection from COVID-19 virus. The top official was released from Siriraj Hospital in mid-March after making a full recovery. As part of his treatment, he received a dose of the Sinovac vaccine, which reportedly strengthened his immune system against the disease. No access to vaccines for most people. However, the problem for most Thais at this time is that there is no immediate access to vaccines, although it is reported that the government may prioritize key areas at risk with the limited amounts of vaccines now being imported. This was a tactic used successfully in the second wave outbreak in Samut Sakhang province near Bangkok. Registration process for the second vaccination phase aimed at 16 million adults in June and July. Over the weekend, authorities began a registration process for the second wave of the vaccination drive aimed at 16 million people, which will take place in June and July, with nearly all the vaccines for this phase targeted at over 60s and those with underlying conditions being provided for by the Siam Bioscience facility in Pathum Thani. The plant has been approved by the government to manufacture the AstraZeneca doses on license from the US-Swedish firm. On Monday, some expats in Thailand, even those with pink Thai national ID cards, were reporting problems registering for the vaccine process through the online More Prom, Doctors Ready application, while foreigners over 60 and with existing conditions, over the weekend, were advised to contact their local hospitals as an alternative, which applies to most foreigners who do not have a Thai ID. Criticism of the government for being too reliant on vaccines as prospects for the country. Critics of the government and some professionals are expressing concern that the kingdom is too reliant on vaccines, particularly as the vaccination process has now become critical to the country's chances of averting further crises both from the disease and economically, as the outlook for Thailand, on several fronts, is diverging from other countries also hit by the crisis but which are expected to recover towards the end of this year. The Center for COVID-19 Situation Administration, CCSA, briefing on Monday heard from spokesman Dr. Episames Risnangson that there were urban outbreaks of concern now in Bangkok, Pathum Thani, Nonthaburi and Samut Prakan.